Hello everybody, my name is Anna Frischknecht and our topic today is vitamin D. I've got a lot of questions with regards to this vitamin and I'm so glad that I could find somebody who is really capable and has profound knowledge on this topic. This is Dr. Volker Schmiedel.
Hello Anna.
Hi, so good that you could come. Can you tell me some words about you?
I have been a medical doctor since nearly 40 years now, and 20 years I was a medical director in a clinic for holistic medicine in Germany, and 7 years ago I came to Paramed in Bar, and I'm very glad to be here in Switzerland. Actually, vitamin D is my favorite vitamin, and 11 years ago I had a master study. And the theme of my master was vitamin D, and what about the levels of vitamin D and how we can get these levels, these optimal levels.
Perfect. So, what is actually vitamin D and what does our body need it for?
First of all, vitamin D is no vitamin, it's a real hormone. We call it the bone hormone because it's very important for the growth of the bone, but it has much more functions. We have more than 20,000 genes in our body, and more than 2,000 genes need vitamin D to function. So it's important for nearly every function in our body. It's very important for our immune system. It's good for preventing cancer, rheumatic diseases, inflammation, cognition, anti-aging, and much more.
So, how does the body process or utilize vitamin D? Are there different types of vitamin D?
We have two ways to get our vitamin D. First, we can eat it. There are some food containing vitamin D, for example, fatty fish, milk products, and the other way is the sun. We can get it by the sun, but only the UV beams are building our vitamin D in the skin. And that vitamin D we eat or we build by the sun is called cholecalciferol. It's a kind of pre-hormone. It goes into the liver, and then we have the 25-OH vitamin D. That's a depot, that's a storage vitamin. And this is changed in the kidney into the 125 vitamin D, and that's very important for the bones. But every cell in our body can build their own active vitamin because every cell needs vitamin D. That's the different forms. The pre-hormone, the depot, and the active vitamin D.
So, what are the benefits and for which organs is vitamin D so important?
I call vitamin D very often the sleeping beauty. Because it was discovered in the early 20s of the 20th century, and it was known only as a bone vitamin D. Rickets. Vitamin D is given to the children in preventing rickets. Then we get to know that it's also good against osteoporosis, so it was a bone vitamin. And then vitamin D sleeps for nearly 100 years. And then there were princes coming and kissing the vitamin D and found out that it has so much more effects for the immune system, for nearly every organ, especially for the brain. Yeah? It's so important for our cognition and preventing dementia. It's very important for the heart, the right function, heart failure or heart infarction. There's nearly no organ where you can say vitamin D is not helpful.
So, how do I know whether I have enough vitamin D in my body or not?
Unfortunately, you can't notice a lack of vitamin D. There is no symptom like magnesium. You will have cramps in your legs. Yeah, that's not the case in vitamin D. Maybe the first symptom is when you get breast cancer. If you have a deficit of vitamin D, your risk getting breast cancer is doubled. So
Wow.
this could be the first symptom. So the only way to detect a deficit of vitamin D is you have to measure it. You have to take a probe of blood and test it. And there are some levels which we know now they are the optimal levels. The optimal level is 40 to 60 nanogram per milliliter or 100 to 150 nanomole per liter. Unfortunately, we have in vitamin D 2 dimensions, which is rather disturbing for the patient, because often patients send me a mail and they say, well, I have 45, is it good or is it bad? And I tell them, well, if it's 45 nanomole, it's bad, and if it's 45 nanocrom, it's pretty good, but I have to have the dimension.
I have heard that the sunlight is full of vitamin D. Is it true? And so, can I just go out in the sun?
It's true and it's not true. There's no vitamin D in the sunlight, but if you have enough sunlight, you can build your own vitamin D in the skin. But you must have the UVB beams. They have enough energy to build cholecalciferol in our skin. And it's built from cholesterol. Cholesterol builds vitamin D, builds cholecalciferol, but only if you have the sunbeams. And you need enough strength of the sun. For example, now we have the beginning of February here in Switzerland, and my vitamin D app just told me this day the next vitamin D building is in 9 days.
Oh.
So here in the central Switzerland, vitamin D is only formed between middle of February till middle of October. And between October and February, we have the so-called vitamin D winter. You can go naked on the marketplace of a town and the sun is shining and you will get no unit of vitamin D.
No unit?
No.
Wow, okay. So what can actually happen if I have vitamin D deficiency? How can it manifest itself?
When you don't have enough vitamin D, you will have a higher risk of many, many diseases. All diseases with inflammation are much higher. Rheumatic diseases, Hashimoto, multiple sclerosis, and many, many more. You are not very well protected against infections, for example, COVID infections. We know if your vitamin D level is below 30 nanomole per liter, and you will get COVID and go to the hospital, your risk to die is higher, and it's 16-fold higher.
Whoa.
16-fold higher risk of mortality in COVID with the lack of vitamin D. And the level of 30 nanomole per liter is not very abnormal. In Middle Europe, during the winter, 50% of the population have such low vitamin D levels. If you have a lack of vitamin D, the risk to die from all causes is doubled. And the lowest risk is above 100 nanomole per liter. If you are going much higher, the risk doesn't decrease anymore, but the aim is to get a level at least above 100 nanomole per liter.
So, it's about the dosage now. How much and how often should I take vitamin D? And is it possible to take too much?
In order to get optimal levels, a normal adult needs 5,000 units each day. A small child, 1 year old, needs 1,000. If you are weighing 45 kilograms and are a young lady, you may need 2,000 or 3,000, but if you have a weight of 90 or 100 kilograms, you might need 10,000 units. The best way to get the right dosage is to measure. I measure just before taking vitamin D, then I give the amount of dosage, and after 3 months I will measure again. And then I can adopt the doses. Well, we are here in Switzerland, and nearby is Einsiedel. And in Einsiedel there was a very famous physician called Paracelsus, and he said, everything is poison. Mm-hmm. Alone the dosage is important if a thing is a poison or not. So you can have damage with too much vitamin D, but it's very difficult. You need much more than 10,000 units each day, and that for weeks and weeks and months. Then you will get an overdosage. It's very hard to get this overdosage, but some are so silly, they take 50,000 or 100,000 each day for months and have no control, and this could be dangerous, especially for the kidneys. You can get stones from that, or the vessels, because you can get arteriosclerosis.
Do certain age groups or people in certain life situations need vitamin D particularly urgently?
No. Everyone needs vitamin D. When I'm asked, when should I start with vitamin D? I usually tell the people, well, you have to start with vitamin D intake just at that time when your mother is pregnant. So you have to start with vitamin D 9 months before your birth. And when should I stop? You should stop vitamin D intake when you don't eat. When you stop eating, you can stop taking vitamin D. So you need it all the time. Yeah. As a young child, you need it for your immune system, for your cognition, in the middle age, and especially in the old age. Mostly old people get their vitamin D from the physician because they want to protect the bone, of course, but you need it all the time, all the lifetime. When someone asks me which are the 2 most important nutrients you never believe, I would say it's vitamin D and omega-3. I will take them for all my life.
So Volker, thank you so much for this very informative and very interesting interview. I'm looking forward to the questions from my patients, my followers. We will keep you posted. See you.
You're welcome.